what is something that when you look back over the last 30 years that you thought you knew about the way the heart works or the way that you should treat hearts that is very, very different now? Nobody would fault you for what it was, but now we think very differently about it.
Well, we didn't really know the etiology of heart attack and heart damage and life-threatening rhythm problems.
Etiology?
The causes. We didn't really know the causes of heart attacks per se. We thought that people would get everybody has three major arteries within their heart, and those arteries supply blood to the heart muscle. And one of those arteries is typically more important than the other two, but each of the three are important, and any of the three can get blockage formation, plaque formation, which if becomes significant enough can impede blood flow and then cause a heart attack. And we used to think when I was just starting medical school that blockages would come from risk factors from heart disease, from people who smoke or have diabetes or high blood pressure or don't exercise and the like, have a family history of heart disease, a lot of other things. And we used to think that people would get a blockage, and okay, they've developed a 40% blockage over the years because of their lifestyle and such, and living in Western society and such. And then they get a 50 and a 60, and then it progresses to an 80, and then a 90, and then a 95, and then a 99, and then eventually it blocks up completely, and we have a heart attack. That's what we used to think. Whereas
that's what I think right now, exactly.
Well, and it makes perfect sense, but we don't do things based on perfect sense. We do things based on what we have found really happens scientifically.
Okay, now I'm dying to know. So what is it?
There's evidence-based medicine, and researching physicians, Eugene Braunwald and some other just greats of cardiology, realized that the cause of a heart attack, that is the cause of blockage of a heart artery leading to lack of oxygenation of the heart, is really caused by, typically occurs on 40, 50, 60% blockages, where that blockage, for reasons that are still unclear, a little bit of, a medium-sized blockage will crack. And that crack inside that artery will release substances that attract other substances to the blockage, and it attracts cholesterol deposits, it attracts little blood clot forming agents, and then all of a sudden that 40 or 50% blockage that is just cracked and released substances will form a blood clot. And so you go from 40 to 50 to 100% just like that.
That would be a pretty big game changer.
And that's what a heart attack is.
Wow.
And that's what happens. And so treatments were developed aimed at, first of all, getting rid of that blood clot that forms, so that if somebody comes in at hour 0 with a heart attack, then it was figured out that time means heart muscle. So if you can get rid of that blood clot and reestablish blood flow within a matter of minutes, or actually within an hour and a half or so, then you're going to have less heart damage than if you are able to open up that artery. And so treatments were devised aimed at initially dripping blood clot dissolving medication directly into that artery right above the blood clot. So people would put a catheter, a thin tube, in the leg artery, which leads up to the aorta, which leads up to where these three heart arteries come out, and drip blood clot dissolving medication. Just drip, 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 and all of a sudden the blood clot would go bloop and disappear. It would have dissolved, and flow is reestablished.
Okay, sounds like problem solved then.
Well, acute problem improved upon.
Okay,
which is important, and that led to improved survival of patients and improved quality of life because of decreased heart damage.
Thanks for watching this podcast short. You can find the rest of the interview on my channel. If you like this video, I hope you'll hit the like button and consider subscribing. I release a new interview with an interesting person every Wednesday morning.